Afeto mega stereo. Kuba niho subwiza. Kuba niho subutunzi. Kuba niho n'ubuntu bwawe.
I would like for you to introduce yourself, who you are, and again, like what you're saying, like you don't really work on the COVID floor, but what is it that you do?
Okay. Hi, I'm Haley. I work as a nurse. I work on a neuroprogressive care unit. I don't work currently on a COVID floor, but if things keep going the way they are, there is a chance that it will turn into a COVID floor.
Okay.
So there is that chance though, so that I might have to work with it. Basically right now, how it is to be a nurse with everything going on is that we can't have any visitors. A week ago, they made it where there was like nothing. Even if the patient was dying, we couldn't have anyone there. They did just change it, thankfully, to where we can grant one visitor and they only get an hour with the family member. So you get 1 hour to say goodbye to the family member, and then we have to escort you out, basically.
Okay.
So that, I mean, that's kind of hard in itself, but I get the patients that were on the COVID floor,
Mm-hmm.
and then if they are deemed negative, okay, let me turn that off. How do I mark this right? Okay. If they are deemed negative, I get them. And that kind of makes me nervous because false negatives. So there's always that chance with any test that you get a false negative and they don't retest them. So I always get nervous that I get a patient that tested negative and then they were just shipped down to
Mm-hmm.
and I take care of them and they get taken off all the enhanced precautions. So when they're on enhanced precautions, as you may have seen on like TV, you know, where we have the eye goggles, the mask, the respirator mask, the gown on, gloves, like everything, it's a big deal. Well, then when you test negative, all of that stuff just goes away.
Okay.
So I'm basically in the room with the patient, just gloves, pretty much. And that's the only thing. So, I mean, they basically came in because they're coughing, they're short of breath, you know, they have a fever, but they're negative for COVID. And so they're still having all these symptoms, but hey, they're negative for COVID. So we're just going to send them down. And that part kind of freaks me out still. So, in that sense, you know, you kind of just, it makes you just want to run and scream the other way, but you can't because in a way, you know, you wouldn't have done that before all of this was happening. You would have gone in there and you would have taken care of them. And we're still doing that now, but it's kind of like you just are like, there's like a moment of like, oh my gosh, like, I know you tested negative, but are you really negative type thing? Like, so, and it's so crazy because you just feel like nobody really knows anything. And everything is so day by day or hour by hour. I mean, we're told to check our emails 2 times per shift. And even that's not really sufficient enough because literally everything is changing minute by minute, hour by hour. Things are always evolving. And, you know, in nursing school, they always told us to adapt to change. And I'm glad that's one thing that's always stuck to in my mind, because I feel like that's the thing that's keeping me like level-headed during all of this is that, yeah, things are always going to change and you're always going to need to adapt. But this is one thing that I feel like I'm like, okay, it's always changing. But there's never like a best answer on how to approach it. And so you're just always scared. It's always like you come home and you're just like, well, am I bringing this home to my family? Like I still live at home and I have 3 sisters here with me and I have my mom, and even though we're all healthy, no underlying like issues, they are all still at risk. Even I'm at risk, and I just would hate if one of them got it. Okay, if I get it, like it would make sense. But if they got it, it would be so like terrible. And that, of course, I would feel guilty because they've been doing what, they're supposed to. They've been staying home. They've only been going out when they need to. It's so rough because I don't know. And then go ahead.
So what would you like for those people that are looking at this and they're family members and they're not really affected by it directly, and so they're kind of taking all these precautions as like stay home, make sure you don't go out and about unless you need to, but they're just taking it like lightheartedly, like they're like, okay, I'm gonna do whatever I want to do because I don't have it, my family don't have it, I'm healthy. Like how important is that, like for real, like to make sure you follow all these precautions?
So it's super important. I mean, they say it's droplet for now, so that's a distance of 6 feet. So that's why they're saying if you do go out, make sure you stay away from people 6 feet. And I can't demonstrate that with my arms, but it is like arm's length away. And then you even notice it, like some stores, they have it where they have marked it for you, like, please stay behind this line while the other person in front of you is checking out. Like that is how far you should stay away from people. Just respect people's space. And if you aren't taking it seriously, I mean, I don't want to like yell at you, but sometimes I do just want to yell because I personally just went through the worst shift and it's only my 1 year of nursing, so I'm sure there's many more terrible shifts to come, but I had to hold my patient's hand while she passed away alone. And that was the most terrible thing. And like her son couldn't be there. We had to FaceTime. And for me, like, I love taking care of people. It's one of the greatest things. I love what I do. Even now, like, even though I'm scared to go in, I still love going in. I still love seeing my patients every day. I'm training a person to be a nurse right now, and I'm just hoping I'm showing him how passionate I am about it. And having to do that made me so sad. And I just wanted to get the message across, like, even though you guys might not think it's a big deal, these people are still like dying alone, or they're still in the hospital alone, and there's other things going on besides this virus that are causing people to be alone. And it's so sad. Like a lot of us nurses count on our patients' family members to encourage them to do things to get better, and without you guys necessarily being able to come and visit them, it really takes a toll on their progression and their health. And it sucks to see that be taken away because we can't just stay home for a couple weeks. Yeah. So it is more serious than just this virus and the cause of the spread. It's also other things that are being impacted. And if we were to just stay home, this would all just go away. It's April 30th. It's almost, I know April just started. Terrible, but it'll go faster than we think. Yeah. And we'll get back to our normal lives. I mean, I miss things too outside of work. Like, work is fun, but
do you think things are ever actually going to go back to normal? Because from now on, it's like if someone starts to cough, like, because I could tell now, like, it almost feels like coughing or sneezing is illegal nowadays. Like, I feel like I can't even like have like a scratchy throat and go because then someone's going to assume that I have coronavirus. And so are we really going to ever be able to get back to normality? Like, it's so hard for me to imagine that day to fully come, because right now it's like we really don't. even in 30 days, we don't really truly know if it is going to end? Or is that like, okay, in 30 days, if we do actually follow these rules, which a lot of people, not everyone does, is going to actually go away? Like, what are the chances of that actually happening in 30 days or April 30th?
I hope so. I hope it does go back to some normalcy. I mean, I think pretty soon here we'll be able to cough and sneeze a little bit more freely. I mean, even I'll like sneeze and I'm like, okay, do I have it? Like, I even am terrified, and I have to talk myself out of like, oh my gosh, you have seasonal allergies. Like, it's that time of the year where your eyes get scratchy, whatever. um but I feel like we will be able to, but I do hope that it kind of opens everybody's eyes to the importance of, hey, if I'm sick, I need to stay home. Or, hey, if I if I like touch something, I should wash my hands after. Like, if I sneeze, I should wash my hands. The importance of carrying hand sanitizer, or like just good hygiene. I feel like it's important, and I hope it just makes people kind of realize, the spread of germs. I feel like it's a good kindergarten lesson for all of us. Again, the importance of washing our hands, and just, if you don't feel good, just stay home, because people, it's not just now that elderly people are at risk, or immunosuppressed people are at risk. I mean, they're always at risk when you're sick. They always can catch something from us. And so if you are sick, just stay home. You're protecting a lot more people too. So, I mean, it's not as severe, but you should just protect others always.
So like the whole, I believe it's New York or whatever, where they're like running out of masks and like gowns for the nurses to wear. How big of an, because in my mind with the whole face mask, I'm like, yo, like what is that face mask really gonna do? Because you're still touching. Again, this is just me as just an everyday person who's walking around. I see people wearing a mask in their car, and I'm like, yo, you still got, like, when you are touching anything with your hands, that's not really. How can you please like tell someone like me how important for a nurse to have those gear and those things? Like, how important is it for them to really have it?
So the N95 mask is actually super important for us because it protects the airborne particles. So those particles are like super small. You know how when somebody sneezes and they don't cover their mouth, you can see like everything just come out. With airborne, we can't really see it. So that mask really protects us from those particles that could sneak through easily through the paper masks that we wear. So for instance, this COVID is deemed right now droplet unless we're intubating, meaning we're putting a tube down somebody's throat or we're giving them an aerolized breathing treatment. That is when we would need the N95. And a lot of these people are ending up needing like a ventilator, or they're needing high flow or BiPAPs. So we end up needing these respirator masks. So they are a huge deal. And when you see people out and about with these masks on, it just frustrates you, because really a simple cloth mask, like what the CDC is recommending people who are not in the healthcare wear, would protect you from, would suffice. It is frustrating. And we're being asked to rewear our masks. We have a paper bag that we can put our mask in, and that's where it goes. And unfortunately, like, that's what it is. And for me, I've come to terms with, hey, I'd rather, like, it sucks that we have to rewear masks, but I would rather have a mask than no mask. Like, at this point, that's kind of where I'm at. And I hate that I have to feel that way, but I would rather have some protection than no protection at all. Like, that's just how I feel right now. And like I said, I hate feeling that way because I know there's so many nurses who don't feel that way. Like, we never should have got to this point, and I agree with that. We never should have gotten to the point where we don't have enough supplies for us.
But how could you have done that without really knowing this whole virus situation that just came? Well, for me, it came out of nowhere. Like for us, how do you really prevent something like that?
Yeah, and given that is true.
Mhm.
And there's so many other factors playing into that as well. I mean, unfortunately, right now I was just listening to the news the other day, and like the people who make the masks were increasing the price of the masks, and Trump put a stop to that, thankfully. But at the same point, like, that's not fair. Like, how in your right mind, I know it's supply and demand, but how in your right mind do you feel comfortable increasing the price of a mask
Yeah.
for money, when it just, there's so many factors. But yeah, and I mean, sometimes there is just improper use. And like right now, they're having our infectious disease people, at least in my hospital. I don't know how other hospitals are being run right now, but they're having infectious disease people come and see if people are on the correct isolation protocols. So, there's different types of isolations, like contact
I do not know.
isolation. Yeah, so there's different. So you have your standard precautions. So that's just automatically gloves for everyone. And then you have contact. So that would be you're wearing a gown and gloves.
Mhm.
And then you have droplets. So that's a mask. And then sometimes it's a mask, eye shields, and gloves. And then you have your airborne, where it's the N95 respirator, depending. Sometimes it's sometimes it's a combination of all of these things.
Mhm.
So you can have a mix of all these, but they're making sure every patient has the correct isolation. And I feel like that needs to continue to
Yeah.
prevent inappropriate use of protective equipment along the board, so that stuff is being used appropriately. But we're learning as we're going, and it's never happened before
Yeah.
either, or we felt this way. And so now I think, well, for me, and as I'm talking to my manager, she said it never happened before, but I also don't know that. Maybe another nurse that's older than me and has been through like the Ebola or the SARS, they had gone through it. But she was telling me that she's never experienced it. And so now they're starting to do that, where they go through. And I just think it's something that should continue down the line, where we are checking and making sure that, hey, yeah, this patient needs it and this is what's going on. But yeah, I don't know. And now we're like asking for donations, and it's just stressful. It's a stressful time in nursing.
At this point right now, huh?
Huh?
So you're basically saying that there's no reason for us to have ever gone to this point. We should have taken smarter precautions at the beginning, so just in case something like this happened. And then also, people who are just buying these masks that can just use a cloth should
Yeah.
just not be buying those things, because there's more important people, that like nurses, that actually genuinely need this to help them do their job better, I guess.
Yeah. Well, I don't want to say like shame these people for buying these things, because I get the fear. Like, I really do understand that. And at first I was like, I actually, like, I'm terrible. I would be like, oh, do you enjoy that mask? Like, to people out in stores, because I was just so frustrated. And whatever, I can be that way sometimes. I have a smart mouth and I'm not always proud of it. But you know there are many sites that teach you how to make a cloth mask. So yes, the CDC is now recommending that if you go out into the streets, you should wear a cloth mask, just because people do not know, people don't always know when they are sick with the virus. So when you go out, you should, for your protection, if you feel that you feel safer with the mask, you should wear a cloth mask. You should not wear a mask that a healthcare worker can wear. And they are not recommending a N95 respirator. So if that's the mask you're wearing, please don't. And if you're wearing a surgical mask, meaning the paper, it feels like a paper thin mask, please don't wear that either. Donate those to the hospitals or something. But you can wear a paper cloth mask. Not a paper cloth mask, a cloth mask. And there's many sites, or there's people on Facebook I know that are teaching others how to make those. And it's easy. And if you don't know, I'm sure there's somebody you know that would love to make one for you for your comfort. Social comfort masks.
So, okay, so let's say for people that, because you don't know if you have it, if you don't have it. So would someone when is it the right time for you to actually go get checked for this situation? Because like a lot of people, it's such a fearful thing right now. Like as soon as you feel a little like sore throat, you start coughing, you're like, oh snap, like I think I got it. And then some people are just like, okay, well maybe I just need to go get checked. Like when is the right time to go get checked, and like what is the best way to go about that situation? Because there's so much fear in it that you just, the smallest little thing, you just get terrified and you think you have it. So when is the right time to go get checked for it?
I'm going to look that up on my phone just so I can state from the CDC.
All right, perfect.
I don't want to give you false information because I know that it's always kind of changing all the time. I agree. Okay. Oh gosh, back. That's not what I wanted. Symptoms. Watch for symptoms. These symptoms may appear 2 to 14 days. Fever, cough, shortness of breath. When to seek medical attention. If you develop emergency warning signs, get medical attention immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. So basically, when you can't breathe anymore. I don't want to tell you that, but so basically, I would say a good warning sign, you typically feel that pressure in your chest. And then I would say that if you notice that you're having a fever and it's kind of not going away, with Tylenol, because Tylenol is an antipyretic, so that means it gets rid of your fever.
Okay.
Ibuprofen does not, and even in any other situation, you wouldn't take ibuprofen for fever regardless. You would take Tylenol.
So is it true that ibuprofen actually escalates the symptoms? Is this true? Or is it
I'm not sure, but I just wanted to clarify, even in a situation where you had a fever, you would take Tylenol. Like that would be the drug of choice for a fever is Tylenol. So you would want to take Tylenol, and if it doesn't go away within 3 days and you notice that you're having more, and especially if you start having increased trouble breathing, that's when you need to go and get tested, but especially with the fever and especially with the shortness of breath. But yes, but like I said, I am not on the COVID floor. I don't get to do the testing for the COVID. So if anything, I would recommend going to the CDC. And if you feel like you have the signs and symptoms of the COVID, reach out to your PCP, so your primary care physician, and talk to them, and they'll kind of lead you in the right direction. I don't really like giving out information about it because I myself, I'm not really up to date, and shame on me for that, but I try and keep my anxiety at bay just because I have so much of it already.
No, so this is not like a professional type of thing. I just kind of wanted to ask you because you're someone that's living in that world. I'm not living in it, so I would have absolutely nothing to share to the world when it comes to this situation. So I just want to kind of give some people an insight of like someone that's actually in it, maybe not fully in the sense like you're not on the COVID floor, but you're still around it. You're still around people that are in that type in that situation. So how bad would things have to get for you to end up having to be on that COVID floor? And how confident are you that things won't get that bad?
So I'm not very confident that things won't get that bad just because so like each unit so I'm on a south tower and each unit houses 40 beds. So there's the second floor, the first floor is ED. So whatever, they have to take patients.
Okay.
Regardless if they're COVID or not, they're housing people, whatever. So then you have our second floor, our third floor. Our third floor right now is our COVID floor. And then you have our fourth floor, which is me. And then you have our fifth floor. And then you have, well, there's supposed to be a sixth floor, but that hasn't opened yet because that's supposed to be a new PCU floor. And each floor houses, so from second to the fifth floor houses 40 beds. So that is 120 beds.
Mm-hmm.
And wait, yes, because there's 20 on each side. Yeah, okay. I'm making sure I'm doing my math right. So 120 beds. The third floor has already overflowed into the fifth floor. So our fifth floor already one side, so 20 beds already has filled up. So then it's going to go over and fill up the other 40 side. I mean, the other 20 of the fifth floor. And then it will come to my floor.
Dang.
So I'm not confident that it won't come to my floor. I'm not confident, yes, that it won't come to my floor. I'm sure it will come to my floor. And I would be lying if I said I'm not terrified, because I am. But I also know that I will remain positive during that time. I'm just going to do my job, and I'm just going to pray and hope that I don't get it and that I do my best for my patients. I mean, it's going to be a tough time for me and them. And we're just going to keep on doing what we got to do. And I just hope that everybody outside of the hospital, they take it seriously. And I don't know, I miss my friends just as much as you miss your friends. I'm fortunate enough to still have my job, and I feel terrible for the people that don't, that didn't. I'm thankful for teachers that still get to do Zoom, because on my days off, I'm helping my sisters do their homework, and wow, what a challenge you all have daily sometimes, or all the time, I should say. And I'm thankful for you guys. But yeah, I feel terrible for, those that don't, but this too shall pass, and I know it will. And I just hope that when we come out of this, we all come out together a little bit stronger and more connected, and we really start loving on each other a little bit better. Not
Yeah,
be so.
so you hit on the whole. You're just gonna keep praying, but because for me, I'm a little more in the religious. I don't want to really say religious, but I believe in Jesus and I believe in God. And so for me, even though with this whole situation, how bad it is, like it's almost been kind of cool to see how much more people are trying to get in touch of more of their spiritual side, whatever it is that they believe. Like, so it's like there's something much greater and bigger than all of us put together. And so now we're actually trying to seek that out and trying to figure that out. And then we're at first it was really wild where people were trying to fight each other for whatever it was happening. But now it's like people are trying to come more together, and that's actually has been a pretty beautiful thing to see. What have you seen on your floor and you're in the hospital that you're working on in that sense, or have you even seen any of that change around? Are people being more? Was it more of like everyone's like not sure and like upset and mad, and now they're trying to be more hopeful, or how have things switched in that sense?
Yeah, I think a lot of us, like, for sure there's times where we're still like okay, what now? We're just kind of like, well, why?
Mm-hmm.
And we get angry and we're pissed. But then there's also times where we just really try and find the good. And we're really, the other day was something as simple as trying to increase team morale, and we're trying to create a team jacket for the entire, like, for our floor. And we're just trying to find little ways to lift each other up. My aunt had made everyone on my floor like a mask that we can all wear, and like that really helped everybody just kind of feel included, and like kind of eased everybody's worry about having a mask type thing. And so there's little things. And everyone says that nurses have a sick sense of humor, but honestly, I think our humor is what kind of gets us through, whether it makes sense to the outside world or not. Like, it helps us, and it's kind of what's there. And I think really having each other and kind of just, I think this has really bonded us in a way. And I don't know. I feel more connected to my team than I did before.
Mm-hmm.
And it's my year anniversary of being a nurse at my facility. So I'm like, what a time to be a nurse. But I think it's made me grow and kind of realize, like, this is what I want to do. And it's just, I don't know. I think I've grown a lot, and it's helping me grow too. And it's pushing me for sure.
Yeah.
But yeah, no, there's little things. And there's signs outside our they're really cute. I'll have to take some pictures, but they say like, you're a hero and don't give up, like everything you do is appreciated. And people are really kind like that. And some food, I can't remember, it was like fork the pork or pork the fork, pork and fork, I don't know, but they were delicious. They brought us food one day for lunch, and just little acts of kindness like that make you feel good. And I mean, things like that, it kind of like eases you for a second, and then you're like, okay, back to the grind. Yeah.
Well,
So
do you have any like final advice or comments for people out there that are terrified and scared and are going through this situation?
yes, gloves, please. I don't care if you wear them, whatever, that's your own little thing, but please don't touch everything and then touch your face or touch inside your purse. Because, like, I don't know, let's imagine you were watching me do my job and I wiped a butt and then I scratched my face. Wouldn't you be like,
Yeah.
what did you just do? Yeah. So that's just kind of how I imagine it when I see you pushing your cart and you're grocery shopping. And I don't mind if you like grab your groceries, because I know you're going to go home, and I think to myself that you're going to wash your fruit and your vegetables before you eat them, or before you cook them for your family. That's my hope. And then, your boxes and stuff, you'll put them away, and then you're going to wash your hands. That's my hope. But what irks me is when I see people touch their cell phones with their gloves on, and then they go and they touch their face, or they pick up their cell phone with their gloves and they're holding. Like, I don't do that during my job. So please don't do it while you're grocery shopping.
Yeah.
You're really defeating the purpose. When you're taking off your mask, grab it from here, because if you grab it here, this part is contaminated. I don't know if you guys watch Fox, I believe it was Fox 10, our infectious disease doctor, Dr. Gill, she kind of goes over this too, how to properly take off your gloves and take off your mask. Yeah, but she talks about the proper way to do it so that you aren't contaminating yourself. And I think those are just important things so that you guys are getting the most effective ways to stay safe. And then please just stay home. I know you guys are tired of it, and I know you probably want to pull your hair out, but it's super important. And I will love you forever. It's almost over. And I promise to keep going to my job and doing what I do if you guys stay home. And I will still go to work if you guys don't go, but
Well,
I love what I do. So.
I just really want to thank you for what you're doing. Even though you keep saying that you're not working on the COVID-4, you're still in that life, and I really appreciate you for one, and thank you, and keep up the great work. And I'll try to convince my friends to stay at home and make sure they don't act the fool out there.
Yes, of course. I'm happy to do what I do, and thank you for having me. I hope I was informal enough. So
You're great. I appreciate you. Thank you, Lily.
You're welcome. It's nice to see you.
Good to see you too.
Afeto mega stereo. Cuba, dijo, sube.